Hi, it's Patrick Hutzel from IntensiveCareHotline.com with another weekly update. In this week's blog, I want to show you how you take control if your loved one has a severe brain injury and is critically ill in intensive care. If your loved one has been admitted to intensive care with a severe brain injury, chances are that you don't really know what it all means and what to do next. In fact, if your loved one has been admitted to intensive care with a severe head injury or brain injury and has been placed in an induced coma on a ventilator with lots of tubes coming out of your loved one's body, you are probably devastated and you feel like so many other families of critically ill patients in intensive care, helpless, vulnerable and out of your comfort zone. To make matters worse, intensive care units are pretty quick in painting a doom and gloom picture for severe head injuries, and they are very quick in breaking bad news for you and for your family. And the first response is often that your loved one has a very poor prognosis. Brain and head injuries are very different from any other admission diagnosis to intensive care, and the major difference is that the brain is the only organ that can't be controlled. All other major organs such as the heart, the lungs, the liver and the kidneys can be controlled, at least temporarily. That is not the case with the brain, and because the brain has a life on its own, it's hard to control it. There are of course things that can be done to minimize the impact of the severe brain injury of your loved one, such as placing your critically ill loved one in an induced coma. However, if the brain injury is severe, the induced coma can only minimize, but not necessarily control, high pressures in the brain that might cause damage to the brain. As an overall strategy, you shouldn't be overly concerned about the doom and gloom picture that the intensive care team is painting, and it's more important for you to ask the right questions in order to take control of the situation. Stay positive as a starting point, no matter what. The right questions you need to ask are: number one, how long would it take for your loved one to recover if the intensive care team is doing their best? Number two, are the intensive care team telling you the truth, or are they only painting a bleak picture because they don't want to deal with your loved one for many weeks in intensive care? Bear in mind, severe head injuries have a much longer recovery time and therefore length of stay in intensive care. Number three, critically ill patients in intensive care with severe brain injuries often recover in their own time, and therefore their length of stay in intensive care is prolonged, difficult and unpredictable. Does that mean that the intensive care team doesn't have the patience, the optimism, the positive culture or the financial budget to deal with your critically loved one adequately? I have written a blog post about how culture in ICU impacts on patient care. Check it out, and I'll put a link below. Number four, some intensive care units that I have worked in had a very positive outlook and very positive culture around their patient care, and therefore also had improved patient outcomes. Is the unit that you are dealing with focused on the positives or on the negatives? Are the people that you are dealing with trying to sell you good or bad news? Number five, are there other admissions waiting to come to the intensive care unit? Is there competition for beds and for staff? Would that be part of how the intensive care unit is trying to position their prognosis for your loved one? And number six, it's crucial that you question the moving parts in the background of an intensive care unit, because without you knowing what's happening behind the scenes and without you asking the right questions, you can't be in control of the situation. For more information and for more in-depth insight that you must know and that keeps you in control of the situation whilst your loved one is critically ill or is dying in intensive care, sign up for your free membership and download your free Instant Impact Report. In the free Instant Impact Report, you learn how to speak the secret intensive care language so that doctors and nurses in intensive care know straight away that you are an insider and that you know and understand what's really happening in intensive care. In this free report, you'll also discover how to ask the doctors and the nurses the right questions, how to eliminate fear, frustration, stress, struggle, and vulnerability, even if your loved one is dying. 5 killer tips and strategies helping you to get on the right path to control, power and influence in your situation. You will get the behind the scenes insight so that you understand what's really happening and how you need to manage doctors and nurses in intensive care to stay in control, and it's not what you think. Thank you for watching this week's blog, and I'll see you again next week in another update. Also, if you have any questions, please send me an email to support@intensivecarehotline.com, and if you have a question, I'll answer it there. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week with another update.